Community health practitioners are quacks. These are some of the words coming out from the mouth of fellow healthcare providers in Nigeria. The word is so irritating, even though it only portrays the level of indiscipline and illiteracy of the person the word is coming from. Mind you, community health practitioners are the heartbeat of healthcare system in Nigeria. Community health practitioners are the solid structure and the backbone of primary healthcare in Nigeria. Let me take you through the memory lane. Before community health profession was signed into law as a professional cadre in 1960 to 1978, let's look at the status of health system in Nigeria then. More than 85 to 90% of the population were relying solidly on traditional medicine. Only the elites, the government officials, and urban residents have access to hospital-based curative care. Facilities were concentrated in coastal and urban centers. Focus was on curative services instead of preventive care. Manpower shortage and the little ones on ground were urban concentrated. Maternal mortality was on the high side. Infant mortality rate was on the high side. Communicable diseases consuming children. There was no workforce to deliver vaccines to the last mile of the country. Consulting clinics only diagnose but does not provide treatment. Lack of basic medicines and equipment. Overflooded tertiary health centers with patients of mere ailments, malaria and typhoid. Poor coordinated system of disease surveillance at the grassroots level. High cost of health care services, availability, affordability, acceptability, accessibility were nowhere to be found. And lot of healthcare challenges then. Were there no medical doctors and paramedical professionals? Yes, of course, but they were not sufficient to the healthcare demands of the population. And that was the solid reason why almighty community health practitioners were signed into law. Not to fight the medical doctors or nurses, but to complement their effort to uplift the healthcare system in Nigeria. Community health practitioners came to be, and they were ready to adapt to rural communities, provide healthcare services to the community, extend the healthcare service coverage to hard-to-reach areas. Immediately after the institutionalization of community health practitioners in Nigeria, there was transformation of rural healthcare from a hospital-only model to a community-first approach. Maternal mortality rate was reduced by 50%. Utilization of maternal and newborn health services was improved by 27%. Treatment of minor ailments like malaria, typhoid, and diarrhea was decongested from secondary and tertiary healthcare level to primary healthcare level. Bridging between the formal health system and local communities was promoted. Immunization coverage was improved by 80%. Communicable disease surveillance to detect early outbreak of diseases was strengthened by 74%. Community health practitioners became the first point of contact for more than 70% of Nigerian population living in the rural areas. Healthcare services were taken to the doorstep of people living in the community. Universal health coverage was sustained through availability, affordability, acceptability, and accessibility of healthcare services by community health practitioners. Antenatal services, family planning, health education, personal hygiene, environmental sanitation, hospital delivery, essential medicine, good water supply, good nutrition, safe delivery were all enhanced by community health practitioners in Nigeria. Anybody that will look at community health practitioners and depreciate them, dishonor them, disregard them is not fair to self. Is not fair to the profession he or she represents, and is not fair to the entire healthcare system in Nigeria. We remain community health practitioners, and we will continue to provide healthcare services to the larger population. Community health is our concern, is my concern, is your concern, and is everybody's concern. Thanks for listening.